Good morning, everyone. Thanks for coming. I'd like to start by acknowledging the work our police are doing in the Gascoyne as they continue their search for missing 4-year-old Cleo Smith. Our thoughts are with Cleo's family during what is undoubtedly an extremely difficult time for them and for everyone involved. To every officer and volunteer involved in the search, can I say thank you for your efforts on behalf of the Smith family. And to Cleo's family, and on behalf of all West Australians, we are thinking of you at this difficult time. I'd also like to acknowledge everyone who was involved in the weekend's record-breaking telethon. The money raised is a reflection of the overwhelming generosity of all West Australians. It is something that is uniquely West Australian, something every Western Australian can be very, very proud of. So can I thank everyone who donated to what is a fantastic cause, one that will deliver real results for those who need it most, the sick children of Western Australia and their families. To the COVID update now, and I'm happy to report there are again no new cases of COVID in Western Australia. The overall number of cases over the course of COVID remains at 1,112. There are currently 3 active cases being managed within our state. 2 in hotel quarantine and 1 in the respiratory ward at Fiona Stanley Hospital. The person in hospital is a crew member from the ship MV Stolt Secura, which departed Fremantle last week. In good news, I can confirm Western Australia's vaccination rate has now grown to 73.2% for first doses and 54.7% for 2 doses. This is based on the eligible population of people aged 12 years and over. As I previously said, given 12 to 15-year-olds have now been eligible for the vaccine for over a month, Western Australia is now including this cohort in our eligible population rate. This is different to other major states on the East Coast, but I think it makes complete sense to include those children who are eligible for the vaccine in our total vaccination rate. On current projections, more than 60% of West Australians aged 12 and over will be fully vaccinated by the end of the week. This is an important milestone. It's an amazing achievement. It shows that despite having had very significant supply constraints, Western Australia's rollout is continuing to climb. For those age groups that have had access to the vaccine for longer, WA's vaccination rates are quite remarkable. For West Australians aged 70 and over, more than 95% have had at least 1 dose. And today I can announce for those West Australians aged between 60 to 69, we have reached a new milestone with 90% now vaccinated with 1 dose, in fact 90.7%. These numbers are encouraging, they are very encouraging. And it shows what is possible when West Australians come together and follow the health advice, we can achieve anything. And we have proven throughout this pandemic. And we've proven that throughout this pandemic. So I urge all West Australians aged 12 and over to please go out and get vaccinated as soon as possible. WA is in a remarkable and virtually unique position. Behind our safe border controls, we can aim very high and do everything we can to minimise the impact of this virus on our state when it eventually returns and potentially spreads throughout the community. Given the geographical challenges associated with a state our size, WA is faring very well. As of yesterday, our first doses for the 16 plus eligible population was over 73.4%, which is above Queensland and the Northern Territory and just behind South Australia. But we need to keep the momentum going, and that is exactly what we have been doing. Yesterday we opened new walk-in vaccination clinics north of the river in Mirrabooka and in our southeastern suburbs in Armidale. We also announced a new pop-up clinic at the Herb Graham Recreation Centre in Mirrabooka starting next week. These complement existing vaccination hubs in Midland, Claremont, Kwinana, Joondalup and the PCEC, Perth Convention Exhibition Centre, and Bunbury Homemakers Centre. And we plan to roll out further innovative ways of getting the vaccine in coming days. WA Health State COVID-19 vaccination clinics are available across WA, with sites listed on the Roll Up for WA website. Across regional WA, there are pop-up clinics in the Pilbara, Goldfields, Great Southern, the Kimberley, the Southwest, the Wheatbelt and the Midwest, which is where I was last Friday. In the Southwest, there will be a vaccination clinic at the Brunswick Show this Saturday. Please, if you haven't been vaccinated yet, visit www.rollup.wa.gov.au and book an appointment as soon as possible or pop into one of the walk-in clinics. Our state-run clinics are an addition to the participating GPs, pharmacies, Aboriginal medical services and GP respiratory clinics, which are managed by the Commonwealth to provide COVID-19 vaccines across WA. If you want to protect yourself, if you want to protect your family and friends, there is no excuse not to get vaccinated. Don't wait for an outbreak. It could be too late. The virus will find people who aren't vaccinated. That is why we have now ramped up our student vaccination program. Eligible students from 75 metropolitan high schools and more than 50 country high schools are being either bused to mass clinics or alternatively given the vaccine on campus. It's important parents sign consent forms as soon as possible to allow the vaccine rollout to occur with students. Delta doesn't discriminate when it comes to how old you are. Age doesn't fight the infection, vaccination does. Now to an announcement regarding changes to our controlled border. We've been closely watching developments in the eastern states, specifically in Queensland, which has now gone 19 days with no cases. Based on updated advice from the Chief Health Officer, the decision has been made to reclassify Queensland from low risk to very low risk. The change will come into effect at 12:01 a.m. this Friday morning. That means any potential arrivals into Western Australia from Queensland will still have to complete a G2G pass and undergo a health screening on arrival. But they will no longer need to complete 14 days of self-quarantine. This means Queensland will join South Australia, Tasmania and the Northern Territory as very low risk jurisdictions whereby travel can take place with a G2G pass and health screening upon arrival. This is good news for WA and for the thousands of people from those states and territories who can safely travel into WA without being required to quarantine. I want to stress again, this decision has been based on updated health advice. I also want to be very clear that if the health advice changes, then we will not hesitate to strengthen border controls if that's what the Chief Health Officer advises is required to protect the people of Western Australia. Our approach will remain cautious and careful, but ultimately very safe. That is why WA's border controls with New South Wales, the ACT and Victoria will remain in place. I'll hand over to the Health Minister to say a few words.
Thanks very much, Premier. Just a couple of announcements today. First of all, I can say the Vaccine Commander has just made the decision that all state-run VAX clinics, that is our big centres, our pop-up clinics and our regional network of vaccination clinics, will now be available for walk-ins. So people do not have to make an appointment in order to get their vaccine. So I repeat, every clinic, state-run clinic in Western Australia, people can now get themselves vaccinated without making an appointment. Obviously, we'd prefer people to make an appointment in order to allow the teams to be ready for them when they come into the clinic, but I can confirm that appointments are no longer necessary. We want to make sure everyone has maximum convenience and opportunity to get themselves vaccinated. We've also learned that the Commonwealth has informed our pharmacies that there will be a delay to their next shipment of the Moderna vaccine, which was due to arrive on Wednesday this week. That has now been delayed till Friday. But this is a very disappointing and concerning development, particularly in the context of the comments by General Fruin in relation to WA vaccine rates. We can't get our people vaccinated if they do not have their supply chains properly honed and prepared to provide us with the vaccines that we need. Clearly, as a result of this delay, hundreds of appointments will be either postponed or cancelled in our pharmacies as a result of this delay. It's a great concern and very disappointing. We are doing our best to get everyone vaccinated under the particularly constrained arrangements around the Commonwealth's vaccine supply chain. We'll continue to push forward. We're having great success now, and I urge everyone to get yourself vaccinated, protect yourself, protect your family, and protect your community. Hand you back to the Premier for questions.
Right, any questions?
So do you agree with the Lieutenant General's thoughts? So you or Western Australia maybe
No, I don't. We expect to get to over 80% double dose vaccination in December, and that's of over 12s. Once we get to that point, we'll have greater certainty on when we can open borders with New South Wales, Victoria and the ACT. Once we get that certainty, that decision can be made. But the reality is Western Australia and West Australians have done a marvellous job over the course of the last 2 years in dealing with the situation we face. We don't apologise for being risk averse in this environment. We want to continue to have great outcomes. So that's what we'll do. We'll continue to roll out new measures to get people vaccinated, as I just announced just now. All sorts of innovative clinics, all sorts of innovative arrangements. We're even going into regional shows with vaccination clinics now. So all those sorts of things will happen. We'll also do further mandating of parts of the workforce, which we'll announce soon, to ensure that we get as many people vaccinated as quickly as possible. We've told people that we will be opening the border sometime next year. Now, we've been really clear about that that's what will occur. And our vaccination rate goes up each and every day. And on first dose, as of yesterday, we're ahead of Queensland and Northern Territory, slightly behind South Australia. And we'll put in place more innovative ways of getting people vaccinated. But I don't want to set dates that subsequently change. I want to have some certainty about what is going on. But people need to understand we'll open when the time is right, when it's safe to do so.
Well, that's not a date.
I can't hear you, Eliza, sorry. No, not at this point in time. A couple of differences in Queensland. Firstly, you might have noted when they made this announcement, they're all wearing masks. Queensland has social safety measures in place, and I don't want to do that at Christmas. Imagine if we opened up like they're proposing to do before Christmas, and then we have to put in place mask wearing requirements and restrictions on the number of people going to restaurants and cafes, how many people can come to Christmas lunch. I don't really want to do that. And so setting out the timetable that Queensland has is not something we're going to do. The other point is, of course, Queensland is very reliant on tourists from New South Wales and Victoria, and obviously that period over January is the strongest time for their tourism industry. We are in a very different position in regards to that, and clearly I want to make sure our businesses flourish and we don't have public health safety measures that would restrict activity and the enjoyment of the Christmas holidays in place in Western Australia. No, I'm not. Doing the right thing by the state, making sure that we remain as healthy as possible, keeping COVID out whilst our vaccination rates continue to climb each and every day, and ensuring that when the time is right next year, we'll reopen to those states in a safe way.
So just to clarify, there's no chance that vaccinated travellers from New South Wales and Victoria will be able to come into WA and quarantine at home for a week or two prior to Christmas?
No, we're not going to do that. We're not going to do that. When you're vaccinated, you can still spread the virus. And if there is health advice that reduces the risk levels of New South Wales, well then obviously we would put that in place. But at this point in time, it's extreme risk. I saw some reports online, actually, I think it was ABC, that indicated they expect that the rate of infection in New South Wales will climb shortly with what's going on there. And I also want to just point out to you, all of the excitement in New South Wales and Victoria, I fully understand, but they're allowing 10 people to go to someone's house for a dinner party, and people in Melbourne aren't actually allowed to go to the country in Victoria, and you've got to work from home unless you you know, if you possibly can, and you're required to wear masks everywhere. I mean, you know, look at us. Our society and our community is very different. And I don't want to go down that route, certainly before Christmas, put in place all sorts of measures to restrict people's activity, fun, excitement, completely devastate the tourism industry over that point in time, potentially have people get sick. We'll just wait till we get very high levels of vaccination before such time as we allow for travel from New South Wales and Victoria.
Is your resolve steeled by your still very, very high popularity?
My resolve is based upon health advice, and it's based upon the fact that I don't want us to fall at the last hurdle. I mean, during the course of next year, we'll have high levels of vaccination, we'll be able to reopen safely our borders, and we'll be able to manage a soft landing. I'm very hopeful. That's what I want to achieve. I don't want to have gone through this 2 years of extreme pressure on the state and the people of the state, and threats at every turn to fall at the last hurdle. So we'll continue just to be safe and keep the state as secure as we can whilst we get our vaccination rates up over the course of coming months.
The Second Board's inquiry reports that the states have failed managing cultural heritage and called for greater federal oversight of those issues. Is that something you'd be willing to explore, and what do you make of those findings?
Look, we'll be introducing new Aboriginal heritage legislation. That will be what we do. I think greater federal oversight on most things is, in my experience, generally a mistake. But we will put in place stronger Aboriginal heritage laws as soon as we can. We're currently finalising the drafting. Many governments have tried over the years. Many governments have tried since the original legislation in 1972. But we expect we'll have legislation ready to go sometime in coming months.
Will any of those findings shape that legislation?
We've been consulting on our legislation now for years. So we're confident that our legislation will protect Aboriginal heritage, give much greater say for Aboriginal people, and do the right thing by heritage in our state. Well, our numbers go up every day. And what we have to do is get ourselves into those areas where there are low levels of vaccination, which is exactly what we're doing. So we're opening vaccination clinics in Armidale and Mirrabooka and Brunswick and communities all over the states and suburbs where there's low levels of vaccination, and making it easier for people to get vaccinated. The figures basically show that people over 60 have extremely high levels of vaccination. But as you go down the age groups, you get to much lower levels of vaccination, which is understandable. We only opened up to over 12 to 15-year-olds, a month or so ago. So naturally, they're going to be much lower. You remember all the issues around making it available for people under 30. That was only resolved a couple of months ago. So naturally, those age groups are going to have lower levels of vaccination than the older age groups. And obviously we didn't get the extra supply early like New South Wales and Victoria did. So, I mean, I think you need to put some historical context around these things so you actually understand, and so we all understand we didn't start from the same position as New South Wales and Victoria, which had mass outbreaks and, you know, hundreds and hundreds of thousands of extra doses of Pfizer per capita above what we got. So in light of all that, I'm proud of the way people are getting vaccinated. I just want them to continue.
Isn't it strange though that New South Wales and Victoria will be allowing people to read Christmas? We're so successful, we won't.
We're a free society. They're not. They're claiming. Hold on, let me finish. They're claiming it's freedom to be able to gather in groups of 10, to have to wear masks when they go outside, to have to wear masks in the workplace. We don't have any of that. So, you know, I'd much prefer our position to their position. No, I haven't, but I would understand it would be very frustrating. The weather is awful. I understand it's awful up there. This is just a devastating situation for that family. I just hope, like everyone does, it has a happy outcome.
Just keep saying, I'll wait until the borders come down, all the virus gets in.
we'll be mandating additional parts of the workforce soon, and that will ensure that a great many people get vaccinated. So that's one of the things we'll be doing. As you know, we're doing all sorts of other things. You know, to go to levers, you have to be vaccinated. I expect when you want to travel interstate or overseas, you'll have to be vaccinated. There'll be all sorts of measures in place to require people to get vaccinated for the good of the community.
Will teachers be in that first group, given that you've got the program now going for high school students?
We'll announce soon.
Is it likely to be a staged reopening of the border as similar to how Queensland's proposing, although maybe different times and dates?
We're looking at those options, but we'll make further decisions on that in the future. Just so you all understand, when you let people quarantine in the community, even though they're vaccinated, when they come from a community that is got lots of COVID, they can still transmit. So that's the problem. Go and get vaccinated in the interest of your health, your community's health and your family's health. It will save you from getting very unwell and potentially dying in the future. You know, the virus can spread to the country. I've heard some people say in some remote communities, oh, it can't come here. Well, it can, only requires one person. So please go and get vaccinated. Thanks very much.